Do you ever feel overwhelmed by the ever-changing world of technology? Tech It Out can help make some sense of it all. Breaking down geek speak into street speak, technology columnist, author, and TV personality Mark Saltzman covers consumer technology each week for every listener. Mark tackles the latest news, reviews, and how-tos to help you understand what's hot, what's not, and why.
Hi, everyone. Welcome to Tech It Out. This is episode 139. I hope everyone is coping as well as you can, of course, with this self-isolation, and hope all of your loved ones are healthy. For me, it's been 2 weeks that I've been cooped up indoors, and despite the odd grocery run, I think I went twice, I haven't left the house. Really weird times, huh? I feel like playing the song Twilight Zone by Golden Earring off the top instead of our regular theme song. I don't know if you remember that one from the 80s, as we are living in strange times indeed, but hopefully we can see the end soon and we can resume normality. Here's to hoping anyways. Speaking of the new normal, Tech It Out today is devoted to the coronavirus. There's several tech angles that we'll explore, as we did last week. In a moment from now, we'll look at a less discussed side effect of the COVID-19 pandemic, and that's mental health. Are you or your loved ones experiencing anxiety or depression because of isolation, the lack of human contact, right? Or you're worried about your income, as many people are, or the stock market, or you've got concerns that you or your loved ones are going to get sick, or if you are sick, that you're not going to get better. There's all these concerns that we've got. So we're going to talk with a psychologist about mental health. Also on the show, we're going to chat with Zoho about its productivity toolset called Remotely, which is being offered for free to businesses until July. And we're going to talk with Ooma about its popular phone service and the rise in people actually talking again because of social distancing. All of this and more on this week's Tech It Out, which is powered by ASUS. I'll tell you more about them shortly, but let's kick off the show. During these challenging times, worried about your family getting sick, what's happening with your job or your portfolio, there's concerns over the kids and their education, and the list goes on and on. One often overlooked part of this entire story is the impact on one's mental health during self-isolation. Now, joining us on the line to talk to us about it and how tech may be in part responsible, like a trigger, as well as maybe part of the solution, we've got Dr. Maneet Bhatia with us. Welcome to the show, Dr. Bhatia.
Thanks for having me, Mark. I appreciate it.
Please tell us a bit about yourself and your practice, and then we'll dive into what's going on with COVID-19 and what issues people may be facing.
No, I appreciate that. So my name is, as you mentioned, Dr. Maneet Bhatia. I'm a clinical psychologist and the clinical director at our private practice in Toronto, where we specialize in mental health support and assessments for children, adolescents, adults, and couples. And we provide, treatment and assessment for individuals struggling with, a variety of psychological symptoms and impairments, including, anxiety, depression, trauma. And we try to, do our best as we can to help people navigate difficulties in their life as they come. And no better time than right now, especially.
Yeah, terrific. Well, for sure, conditions like anxiety and depression come to mind as events like this COVID-19 outbreak could be a trigger for mental health conditions. Are you seeing a spike? And I guess the irony is that we're not supposed to be leaving our homes in order to seek treatment. So we'll get to how tech may be part of the answer as well. But are you seeing a spike now with this coronavirus outbreak?
Yes, no, of course. And I do appreciate you contextualizing it around technology, because I will start by saying that, since last week, our entire office and operations have gone remote, and we're basically working only through the means of video or telephone therapy at this point. Mm-hmm. So since last week, and just, full disclosure, I had come back from out of the country myself. So I'm in self-isolation regardless of what was happening with this latest kind of increase. So I had moved my entire practice to online. But absolutely, we're seeing many things. We're seeing, an increase in people's anxiety, because obviously we look at anxiety as a condition. In a general sense, anxiety is based on, triggers that are either physiological or psychological based on what's happening in society or around us. And it's our alarm system towards responding to threats. And it triggers feelings of uncertainty and worry and fear of the unknown, and a lot of future concerns, and what if this, what if that. So this whole COVID-19 is a complete kind of shock to the system for everybody, let alone anybody who has anxiety or other conditions, because we're in a whole new world. There's a lot of uncertainty and fear about our own health, those of our loved ones. So people who already have anxiety, I'm seeing a lot of exacerbation and increase of the severity of their symptoms. And also on the flip side as well, so you have that anxiety around what's going to happen to me or my family or my finances, my future. Are my loved ones going to get sick? Are we ever going to have normal again? That triggers a lot of worrying thoughts and fears. But also on the other side with the depression, given that we are now, living in an era of social distancing and self-isolation, that also can really trigger stronger feelings of alienation, loneliness, resolution and hopelessness in patients who typically try to reach out for support.
Right. I understand that perfect storm, unfortunately.
Mm-hmm.
At the very least, I think over the years, the stigma surrounding mental health issues has eroded somewhat. And I think that's a good thing, trying to break down barriers and let everyone know, hey, it's okay to feel the way you feel and it's okay to be vocal about it, and to encourage people who are quote unquote healthy to look for signs among those who may not be, and to always remember that when you're dealing with someone at work or a family member, they may have something that they're struggling with and it may not be, worn on their sleeve. So with that in mind, how could you tell, especially now as we're cooped up at home, what are some of the ways that we can tell if someone is going through some kind of emotional distress?
Yeah, I think it's a really good question. I think, it's what I would say, in the past would be, if they're kind of staying at home or not socializing or not going to work or not leaving the house, which are kind of normal behaviors right now, if you think about it, right? Mm-hmm. So I think it's kind of, we got to look at the context, and that's a case actually with mental health in general. It's always about context and relative to what we typically are and what context and environment we're in. But, things that we look for right now is, I'll give you a quick example. Like I'm working with a patient who is working from home now. So her employer is being supportive of mental health. I mean, relatively speaking, and saying you can work from home. There's no issue there, but she can't focus, right? And she can't focus her mind on her work. And it's not that she forgot how to do her job. It's that she had a closing on a cottage, or she had, or there was a car payment that has to be made. And there's anxieties about how am I going to pay my bills? And how am I going to take care of my child who's in the other room kind of screaming or taking a nap, and I can't focus on my job. So things like if you're having a disruption in your ability to concentrate, to focus, to do the things you used to do, and if these symptoms of worry or anxiety, or in the other cases of depression, where people are starting to feel more sad, loss of motivation, and you're noticing that even when they talk to you socially, they're kind of disconnected, or they're not being productive in their work time, or you're noticing their appetite is reducing and they're not sleeping well. So things like sleep, appetite, mood, if you're noticing more irritability, more arguments, these are all kinds of signs that the individual is probably dealing with some stress. And the first step to get to get help or to deal with that is, as a partner or a loved one or a friend, make sure you reach out, and try to be there and support them. And I think you and I'll talk more about how technology can be a huge part of that. But, the first step is to, if you're noticing it other people, try to reach out and say, hey, Mark, how's it going today? How are you feeling about this? But if you're feeling it yourself, and you're realizing, I'm not feeling right, first I'd say talk to, acknowledge it in yourself, not to judge it or shame it, to understand that we're living in extraordinary times, and to talk to people you trust and you love, let them know where you're at. And then at that point, if you feel you need more support, reaching out to perhaps a mental health professional.
Thank you for that. I hope that is helpful to those who are listening. Dr. Maneet Bhatia is our guest to talk about mental health issues surrounding the COVID-19 crisis. Now, some may say, Dr. Bhatia, that excessive screen time and social media and being glued to cable networks can all be a trigger for mental health issues. Is that fair? Do you agree with that?
I would say yes. I would say that, I would say that it's all about setting healthy limits and having, accessing technology should be something you do in moderation, right? Like anything else. So I do think excessive screen time and social media, especially right now, because we're living obviously in a time that's extraordinary, and every second of every minute of every hour, every day is being spent on the COVID-19 outbreak and analysis. And if you're somebody who right now, for example, who already is dealing with anxiety, we go back to the beginning of our conversation about, triggers. Part of anxiety is being triggered by threats. And if you're constantly watching news that's talking about potential threats, or another person got this illness and one more dead, or presumptive cases, or we're shutting this down, or that person did this, what you're doing is you're keeping your alarm system, which is basically your anxiety system, constantly working. And you're constantly in a state of triggering and creating anxiety and worry. So what's the solution? Because, part of it is we want to have access to information. So one of the things that I recommend is setting strong limits on how much information and screen time you give yourself. So what I recommend to patients myself is pick 2 to 3 times in a day that you're going to dedicate to, screen time, social media / news watching or whatever. And pick also information that's from a credible source, not places that are sensationalized or, kind of catastrophizing or just spreading wrong information. Also, it's important within social media, like, I don't know about you, Mark, but I'm sure I'm on numerous WhatsApp groups, and every minute you get a new message from somebody saying they found this vaccine or they have this going on or that person this or that person that.
It's overwhelming, yeah. We'll continue chatting with Dr. Bhatia when we return on Tech It Out. Stay with us. A lot more to come.
Listen to Tech It Out whenever you want. Find the Tech It Out podcast at iTunes or wherever you get your podcasts.
Welcome back to Tech It Out. We'll continue chatting with Dr. Bhatia, a psychologist, in a moment. First, though, this show, Tech It Out, is powered by ASUS. For those in search of incredible, ASUS creates technology for today and tomorrow's smart life, including its line of award-winning laptops, desktops, monitors, smartphones, tablets, smartwatches, and much more. For those in search of incredible, visit asus.com/US/radio for more info. That's asus.com/US/radio. Now, before the break, Dr. Bhatia, we were talking about technology being overwhelming, especially in this day and age with all the information going around and misinformation about COVID-19.
It's overwhelming. And then you're sifting through whether what they're sending you is real or fake because it's forwarded 50 times, and you're trying to figure that out, but you're also trying to manage your own stress. So what I tell patients and myself is that, and people around me, is that this is, essentially we're dealing with quite a traumatic experience right now. And we all handle and process trauma and stress differently. And it's important to set boundaries. So if you're on a chat where people are bombarding you with information, maybe you just mute it for a bit. Maybe you go somewhere else where you feel it's less about COVID-19 and more about, how you're doing otherwise. So finding moments to set boundaries and to feel comfortable with limit setting, because otherwise it will truly overwhelm you.
Yeah, that's a great point. Thank you. So agreed that technology without moderation may be a big part of the problem, but tech could also be part of the solution. For example, I've been talking all week on TV stations, over Skype, of course, about using Skype and other video calling platforms to stay connected with loved ones who are also self-isolating. So maybe you can expand a little bit on using technology to help curb some of these issues. And then if you could talk a bit more about actually using video chatting as a tool in your business, that's really interesting. I don't know if this is something you've done prior to the COVID-19 pandemic, or if this is something you've been doing for a while now as an option to an in-person meeting.
Yeah, so I'll start with the second part of your question first. Yeah, we've been using video conferencing. So the video conferencing we use, and this is important for everybody listening out there. So psychologists, mental health professionals, we do have access to, different online video conferencing platforms that are, that comply with the privacy legislations of our provinces, our states, our jurisdictions, that have end-to-end encryption, which is a fancy way, maybe Mark can tell you more, but a fancy way of saying that these particular vehicles and the mediums are safe and secure and confidential. So the same confidentiality you'd expect from a face-to-face interaction would be provided by these particular video conferencing solutions that we use. And then also with telephone therapy as well. But yeah, I have used video conferencing as part of my practice for many years for clients who may not be able to come to the office, or there's weather issues or mobility issues, but it's completely become the way of working since the COVID-19. And that's really important for patients to know, because those of you who are sitting at home saying, well, I want to talk to somebody, but I don't want to leave my house, right? Or, so there is access, and many, many mental health professionals are utilizing those particular avenues right now to reach you. And they are safe and secure and confidential. And there's no data that suggests that the efficacy or the quality of service in terms of treatment outcomes is any less, if you will, right? Now, with respect to your comment about can technology be part of the solution? Absolutely. One of the tips I provided on my website was, we're living in social distance, but we can socialize with distance. And with distance, that comes the idea of, yes, you can text a friend, you can call a friend, you can FaceTime or Google Duo or fill in the blank social media device, and reach out to people and engage in these kinds of ways of staying connected in a safe way. Full disclosure, every day I FaceTime with my family, we're not here, and or with friends, we do group chats. And this is very important right now in this time, given that we're all feeling so disconnected, in the physical sense, but it does not mean we can't talk to people through technology. So, this is the positive side of technology and screen time and social media in the current state of affairs.
I love that. Just because we're self-isolating doesn't mean we need to feel alone.
Correct.
I also encourage people to reach out, especially those who live alone or elderly folks who, may not be as comfortable with a video call. I'm generalizing. That's not always the case, but you can always pick up the phone or send an email, a text. There's many different ways you can reach out. It doesn't always have to be over Zoom or WhatsApp video or anything like that. The point is that it's a human-to-human connection. So you said that you've offered tips before, and I'm sure there are other suggestions that you've got for those listening or for our loved ones who may be struggling. Where could listeners reach out for more information? What would you recommend?
Yeah, so if, for our website at bhatiapsychology.com, we have some tips there at our website. But also, if, it's in the general population, it's always important if you're looking for psychological specific help, and looking for a therapist resources, there's a wonderful free resource that's, across North America for sure. It's called psychologytoday.com. There you can find a therapist. You can search for topics in literature. If you're feeling down and out and you want to reach out, even calling your doctor's office or searching online on Google. So there's a lot of mental health professionals out there who are accessible. Our perspective always is it takes a lot of courage to reach out, but when you do, it's worth it. So we understand how hard it is, and we want to acknowledge and validate that anxiety and fear to even reach out. But you're not alone. And as you said earlier, Mark, there's no shame, there's no stigma in reaching out right now. It's the same as getting a physical illness or ailment, and there's no shame in reaching out. And in whatever capacity you can, we're here to help.
Fantastic. Again, bhatiapsychology.com. So that's BHATIA psychology.com. Dr. Maneet Bhatia, thank you so much for your time and your insight. It's been a pleasure chatting with you, and I wish you and your family well during this crisis.
Thank you so much, Mark, and you and your family as well. Take care.
We'll be right back with more Tech It Out. Stay with us.
Want to follow Mark? Google him. Mark with a C and Saltzman with a Z. Breaking down geek speak into street speak. This is Tech It Out. Tech It Out with technology columnist, author, and TV personality Mark Saltzman.
Welcome back to Tech It Out. Throughout this entire show, we've been discussing the impact of coronavirus on society and how technology can help us cope with the pandemic. And that includes our self-isolation. And now we're going to learn about some interesting findings from Ooma about the increase in voice calls between us, which might not come much of a surprise to many. Ooma, of course, offers an extremely popular alternative to landlines for both consumers and businesses that leverages voice over IP or VoIP technology, calling over the internet. Joining us to chat is Jim Guskey. He's the Chief Marketing Officer at Ooma, based in the Bay Area. Welcome to the show, Jim.
Hi, Mark. Thank you for having me.
How you holding up? It's good to chat with you.
I'm holding up well, and like many other people, I'm working from home.
Right, and trying to make the best of the situation while hoping our loved ones are healthy, and we're trying to stay as productive as possible. So I do appreciate your time, especially I know you are working from home. Before we talk about these findings tied to the data that Ooma has been collecting in March, tell us a bit about the company, Ooma. So it's OOMA, for those who haven't yet heard of the company.
Yeah, I'm glad to. As you said, Ooma is what's called a voice over IP or VoIP service, phone service. We cater to both businesses and homes. And we've been around for quite some time, and we have about 1 million customers. And as you said, we're a great alternative to traditional landlines for residences and traditional phone systems for businesses as well.
I remember the first thing that struck me when I tried Ooma many, many moons ago was how good the quality was of the phone call. My experience with VoIP prior to Ooma was not very good at all. So what would you say elevates Ooma compared to other VoIP services when it comes to quality and features?
Yeah, there's really 3 things that really make Ooma stand out versus our competition. And the first one, you said it correctly, it's quality. Ooma has developed a really unique technology that we call adaptive redundancy.
And you also don't sacrifice features, right? You've got all the things that you want, in a phone system.
Yeah, we've got everything you would ever want in a phone system and more. One of the really unique features we have for our home phone service is 911 text alerts, so that when you dial 911 from your home, you can have up to 4 people also receive a text notifying them that you've dialed 911. It can become very useful in the case of an emergency.
Oh, I like that. I didn't know that. We're chatting with Jim Guskey. He is the CMO at Ooma. You mentioned there was 3 sort of pillars or 3 advantages to Ooma over your competitors. One is call quality. The second, a feature set. What would be the third?
Value. One of our tenets when we were founded over 15 years ago was that we were going to provide extreme quality at a great value. And on the residential side, what that means is free home phone service. All you pay are taxes and fees. On the business side, it means very affordable per user pricing of $19.95 per user per month, which is very disruptive in the industry.
So now let's talk about some interesting data that Ooma collected over the past couple of weeks.
Where we've seen the greatest impact over the last couple of weeks is call duration. Everything is up. Let me be clear about that. But call duration is where it's extremely up. For example, outgoing minutes, that would be the amount of time on the phone from a call that you make, is up 88% versus the previous month. Incoming minutes is up 75% versus the previous month. And overall call volume is up 40% versus the previous month.
Wow. Okay. So frequency and duration is up across the board because I guess we're cooped up at home. We want to reach out to our loved ones, make sure they're well, and also maybe calling the office and things like that.
Yeah, for me, especially working from home, I'm making a lot more phone calls than I have in the past.
Mm-hmm. Yeah, it's true. I know the generalization is that we're talking a lot less and we're typing a lot more, whether it's a text message or an email. But it's kind of good in a way to actually go back to the basics, whether it's a regular phone call or a video call. It kind of brings in that human element once again. A very small, silver lining, I guess, among all of this craziness right now. So going forward, Jim, if those who are listening want to try out Ooma for home or for work, what gear do you need? Like, how do you get going? Is there a price that's a starting amount? You talked about $19.95 per user per month for the business side. If you can elaborate on the free offer for consumers, that'd be awesome as well.
Yeah, no problem. We manufacture a consumer electronics device called the Ooma Tello, and it's sold at all major retailers. And it's a little Linux computer that you plug into your internet connection and then plug into any home phone. So once you buy Ooma Tello, and the MSRP is $99. Okay. then you can hook up any phone, and it works just like a traditional landline.
So you can, at that point, cancel your landline at home if you're ready to cut the cord, and you just plug the back of your cordless or landline phone into the Ooma Tello, and now you can use that as your system, if you will. Do you keep the same phone number?
Yes, you have the option to transfer your current phone number, and for a lot of people, that's pretty important. It's a number that they've had for a long time, and they want to keep it.
The 911 calls are for the landline option is still the same, or is there any caveats there?
911 calls are location-based calls, which means when you call 911, your address automatically gets passed to the operator, which is significant because I don't think a lot of people know that many times when you dial 911 on a cell phone, the closest the operator can get is the nearest cell tower.
Right.
And even when they can locate your exact location, like multi-story buildings can be an issue. They don't actually know what floor you're on. So traditional 911, location-based 911 service is really important, and that's what Ooma offers.
Okay, I like that because we may not be in a situation where we can talk, either because we're too ill to talk or heaven forbid, there's a break-in and you don't want to make any noise. That's great that the emergency operator will know your address, because I know that was a concern with VoIP in the very early days, but I'm glad to see that problem is history. So the website, I guess, Jim, to learn more is simply ooma.com, OOMA.com. And as you said, many retailers, I know like Costco, for example, they have their hardware in their stores, in their warehouses.
Yeah, absolutely. Best Buy, Amazon, you can find us anywhere, and it's ooma.com, OOMA.com.
All right, Jim. Jim Gusky has been our guest. I'm wishing you well and your family. Thank you very much for talking to us today.
Thank you, Mark.
We'll be right back with more Tech It Out.
Breaking down geek speak into street speak. Tech It Out, hosted by Mark Saltzman.
You're listening to Tech It Out on the Radio America Network. Welcome back to the program. This show is powered by ASUS, creating technology for today and tomorrow's smart life. ASUS, for those in search of incredible. Visit asus.com/US/radio for more info on their awesome products. That's asus.com/US/radio. During this COVID-19 crisis, where literally tens or even hundreds of millions of people are now forced to work from home, at least in the short term, we've been covering on this show ways to remain productive while at home. And we're now going to learn about Remotely from Zoho, which is also being offered for free until July to businesses, which we'll get to as well. But joining us on the line to chat is Chandrasekhar, who goes by LSP. He's a product evangelist for Zoho Corp. Welcome to the show, LSP.
Thank you very much, Mark, for having me on the show. Appreciate it.
Yeah, of course. And how are you holding up? Everything okay on your end?
Oh, thank you for asking. Absolutely. So far, so good. Just doing the right thing as per the instructions that we are all being given out, doing a whole lot of social distancing and doing the right thing.
That's indeed the case on our end here, and hopefully many people are abiding by that call to action, or inaction, let's say. But before we talk about Remotely, what is Zoho all about?
Well, Mark, Zoho is a software company that was started in 1996. It was a bootstrapped company. We have been private, and we intend to remain private. And in this 24 years of our existence, we have churned products after product. Right now, our focus is business software. And when I say business software, I'm talking about every aspect of a business, be it sales, marketing, finance, HR, or productivity and collaboration. We have a whole slew of products that can help any business with their automation or digital requirements, so to speak.
I remember when you first started, it was like a productivity suite with like a word processor and a spreadsheet maker and presentation creator, but you've evolved quite a bit since then.
I'm impressed, Mark, that was the history as far as the cloud-based software offering goes, and these started essentially sometime in 2005, where we started our foray into cloud-based software. So yes, we did start with the word processor, spreadsheet, and presentation tools.
All right, now please tell us about Remotely, which is part of the Zoho family. What's that all about?
Here's what happened. Sometime in the end of February, we as an organization across all the global offices, we have about 11 offices, over 8,000 employees, decided to go remote and work from home. And this was in the wake of the current crisis that we're seeing, and then we decided that we're going to go remote. At that point, we started using a whole lot of tools that we had built all along for collaboration, for internal communication, for external communication, remote support. And then a week into this, we decided, we got to make this available as a bundle for anybody who wants to try this, because we are presented with a new challenge that every business out there has to address. So on the 1st of March, remotely did not exist. On the 6th of March, we released the product.
All right.
Everybody was working remotely.
Yeah. So, I mean, the name kind of summarizes what it does, is it allows remote workers to work together remotely as if they were in the same physical space, and the timing couldn't be any better. But remotely is a collection of tools, from what I understand. Is it similar to the likes of Slack or Microsoft Teams?
It's a combination of everything, Mark. What remotely is a collection of 11 cloud-based software that any person or any business that wants to engage in remote work needs. It could be internal communication. It could be external communication. So internal communication is what you would use Zoho Click for, which is similar to Slack. And if you're looking at external communication, doing a video conferencing or a webinar, then you would need the right tools for that, which is what Zoho Meeting is all about. And over and above that, if you want to do training, then there is Zoho Showtime, which is a tool that you can do remote training sessions, and you can have interactions through that particular platform. Apart from communication, internal and external communication, there is this whole aspect of doing project management. So if you want to track time, if you want to kind of take control of what people are working on, then there is Zoho Projects, which is a tool that will allow you to do waterfall-based project management. And if you are a high-tech company into software, then you would want to kind of do agile project management, which is what Zoho Sprints is for. And the other aspect of remotely is remote assistance, wherein if you are into IT business, or if you want to help people remotely logging into their desktops or laptops and helping them doing some troubleshooting and fixing issues, that's where Zoho Assist comes into play. Then there is Zoho Lens, which is a new tool that we released, which is going to turn your phone camera into a streaming device. And if you are into field service, let's say you're out there, an electrician or a plumber or somebody from the telco company, and they want to go and stream what's happening to somebody who is sitting remotely in their home office to help fix issues, then you turn your mobile phone into a streaming device. That's what Zoho Lens is. And then finally, on top of all these set of tools, we also brought in the initial tools that you mentioned, such as the word processor, the spreadsheet, and the presentation tool. This combination of 11 products is what remotely is all about. It's end-to-end for any kind of remote work that you want to do.
Wow, it sounds like it. We'll continue chatting with LSP from Zoho about remotely when we return on Tech It Out. If you have any questions for me, any comments on the show, any feedback you'd like to share, you can hit me up at tech@marksaltzman.com. That's TECH@MARCSALTZMAN.com. Or I'm on social media as well. We'll be right back.
Follow Mark Saltzman on Facebook, on Twitter, on Instagram. Listen to Tech It Out whenever you want.
We're chatting with LSP. He's an evangelist for Zoho Corp. We're learning about remotely. It's a suite of tools to help you remain productive anywhere, anytime, and on virtually any device. Out of all the apps that you've just walked us through, like Click and Meeting and Projects and Showtime and Lens, which one is your favorite and why? What's the most unique, perhaps?
Great question. It's a tough question, by the way, but I'll actually have to say it's Zoho Click and Zoho Meeting, simply because internal communication is all driven by Zoho Click, where be it a video call or a audio call or a instant messaging, Zoho Click extensively. And since it's also available on mobile, it really kind of gives me the ability to reach out to anybody or anybody to reach out to me at any point in time.
And to clarify, Click is spelled CLIQ, correct?
That is correct,
okay.
Yes. And as far as the other tool that I mentioned, Zoho Meeting, this is what we use for external communication, be it with clients or analysts, and all those kind of interactions happen through Zoho Meeting. So I end up using these tools the most, and by virtue of what I do for the company, being an evangelist, these communication is an important aspect of what I do. So these two kind of top up. But my personal favorite in terms of the other tools is also the Scrum-based project management tool, which is Zoho Sprint.
Okay, now earlier I asked you, LSP, how Remotely compares to other software platforms that bring teams together and workers together. But from what I understand, another key differentiator is that Zoho is offering Remotely for free to companies. Can you elaborate on that?
Absolutely. Because we started working remotely, we wanted to make these tools available to any business out there that wanted to adopt a work from home policy to address the current crisis that we have. So we decided that we're going to make Remotely available for free of cost to any business of any size until the 1st of July. And this is a reaction for us as far as the bundle being made available is concerned. It's a reaction to the crisis, and we have opened it up for anybody to adopt remote work policies.
Wow. So how does one get going? There are many listening who work at a small to medium-sized business. So how would they get going?
It's pretty straightforward. All that anybody has to do is go to www.zoho.com/remotely, sign up, and get going.
All right, zoho.com/remotely. And how much does Remotely cost normally? I think you said the offer is good for free till July, but after that, what would it cost?
As I had mentioned earlier, Mark, this is a reaction. We have not even had the time to think about how we would price this. We wanted to make something available for businesses, and that's what we were working on right now. It's to get the word out. That's what the missionary is working for over time. And one thing I can affirm is all things Zoho, it will definitely be pocket friendly to business of any size.
Fantastic, LSP. Thank you so much for your time. Good luck with this new product, Remotely, from Zoho Corp. Zoho.com/remotely to learn more and to sign up. Thank you very much. I appreciate it. Thank you, Chantra.
Thank you so much, Mark. It was great. Thank you.
Hey, I hope you've been enjoying this episode of Tech It Out, where we are exclusively focusing on COVID-19 and some of the tech side stories, everything from mental health to staying productive to the rise in voice communication, and if that's a good thing or not. I do think it is a good thing. And last week, if you want to listen to the March 20th podcast of Tech It Out, you can do so. It's also tied to COVID-19. I spoke with tech expert Amber Mack, who talked with us about video calling and online fitness classes and keeping the kids entertained while at home. We also spoke with ASUS, the title sponsor on this show. They shared the details on a powerful new business grade laptop. Also, we spoke with Microsoft about Teams, a very popular collaboration and communication tool that many are relying on now more than ever as we're working in different areas, but with the same team on the same campaigns. And then finally, last week, I also shared some gadgets for staying at home, including a hands-free faucet, 5G smartphones, and so on. Anyhow, again, it's the March 20th episode of Tech It Out. You can hear it on your favorite podcast platform. And again, you can reach me at tech@marksaltzman.com. TECH@MARCSALTZMAN.com. Or if you prefer, you can hit me up on social media. I'm on Instagram, Facebook, Twitter, LinkedIn, and YouTube. This show, Tech It Out, is powered by ASUS. Thank you for your ongoing support. The company creates technology for today and tomorrow's smart life, including its line of award-winning laptops, desktops, monitors, smartphones, tablets, smartwatches, and much more. And that includes the ROG, or Republic of Gamers, line of gear. If you're into computer gaming, you no doubt know about ROG. They've got some awesome stuff, which you can also check out at asus.com/US/radio. Again, that's asus.com/US/radio. I'm wishing you all a healthy week ahead. To you and your family, good luck with the self-isolation. Reach out to those perhaps living alone. Let them know you're thinking about them. Have a great week ahead, everyone. Speak to you next weekend on Tech It Out.